Hey guys, welcome back to my channel, and if you're new here, my name is Kristina. In my videos, I talk all about nursing school and a plant-based diet. If you like these types of videos, like this video and subscribe down below. In today's video, I'm going to be talking to you all about the Fundamentals HESI. Let's get into it. The Fundamentals HESI exam was an exam that I had to take during my first semester of nursing school. So now I'm in my last semester, and that was a few semesters ago, but I still remember a lot from it. So the first thing that I want to make very clear is that this book right here, the HESI green book, or if you have a red one, depending on the edition, this is 6th edition, and it is by the makers of Elsevier, which a lot of schools, they use Elsevier products, so you'll see that reoccurring. This book is a lifesaver because it goes over everything that you'd possibly need to know for that exam. They pull questions from there in terms of the information, and anything that you might have a question about, I would definitely advise you to look directly there because those are the ones that are going to be making your HESI exam. The first thing that I want to make clear is that when you're going to study for this exam, you have to realize that there's not a specific section within the book that actually goes over fundamentals HESI. It doesn't explicitly state that. So what you're going to have to do is look at the first few pages here, and I see up from chapter 1, which is more like test taking strategies, up until even chapter 3. So those are the chapters that I would focus on if you are taking the fundamentals HESI exam. Chapter 3 goes into more advanced clinical findings, more of like med-surg things, but there's some things in there that you may have learned that will definitely help you on your exam. So in my previous HESI video, I talked all about the fact that HESI really wants you to be safety oriented. They want to make sure that you as a nurse are going to be safe around your patients and what you would do. So the major thing that I want you to understand is that you're going to look for the answer choices that are least invasive first. Now, if you have a patient that's hemorrhaging or bleeding out, or their O2 stat is like 50% or something like that, then obviously you're going to have to do something more extreme, but typically you're going to assess a patient first because that is the part of the nursing process. First, you always assess a patient. Even before you call a physician, you have to assess a patient because you can't call a physician without knowing any information about the patient or knowing what's going on. Imagine having a patient and calling a doctor and saying, hey, I have a patient in room 2 and I'm not really sure what's going on with her, but I think you should come see her. The doctor is going to be really angry that you just wasted his time because you have no idea what's going on with your own patient. So it's really important that you need to assess a patient first, which should always be implemented in your head. ADPI is what you have to go for. Now, if there's a question that doesn't go over the nursing process, meaning if your answer choices don't say assess, evaluate, things like that, those key terms, then you have to go more into Maslow's. So now Maslow's is the triangle that you have to look up and make sure that you really understand what things fall within that pyramid, because the bottom is like physiological needs, and then it goes into psychologic needs, and then it goes further and further. Now, if you know those two concepts between knowing your ABCs, which is airway, breathing, circulation, and then if you know Maslow's, if you combine the two, you will be able to answer a majority of your questions if you really understand those two processes. Make sure that when you're trying to learn that information, that you have questions that are associated with those types of nursing processes and Maslow's so that you can know if you're actually understanding it. It's one thing when you memorize a chart or memorize certain steps, but trying to apply that to certain questions is a lot harder. So when you're going to study for this, I suggest watching some YouTube videos. There's really great YouTubers who have made questions in regards to Maslow's and ABCs so that you could have practice. So I'm just going to run through the first few pages of this book just to give you guys some ideas. If you don't own this book, this will definitely help you, and if you do, it'll just help you be able to see what I'm talking about and what areas to focus on because I've taken it and I passed my first try. So literally on page 1 of this book, there's a HESI hint that states, the most essential element of nursing care is client safety. So like I just said a few minutes ago, Client safety is the most important thing that you want to watch out for. If you see a patient at a fall risk, you need to assess them. You need to see what's going on with them. Maybe they have their bed rails down. You need to assess and apply safety measures for that patient. Now, a lot of people have asked me through Instagram if you need to know any lab values. So typically on the HESI exam, you'll at least get a few questions where you'll need to know those lab values because you'll need to know what's going on with your patient. So some of the lab values that HESI wants you to know, or they say are the most beneficial ones to know, are things like your electrolytes. So for potassium, extremely important for cardiac issues. Sodium goes hand in hand. Then we have calcium, magnesium, chloride, and phosphate. So then it also says that it wants you to know BUN and creatinine, the relationship between calcium and phosphate, because we know that they're inversely proportionate. So if one goes up, the other one goes down, and vice versa. Then it says to know about your ABGs. So you really need to know what an acidotic patient looks like and an alkalotic patient looks like. And is it a metabolic situation going on, or is it respiratory going on? So if you're like, I have no idea what you're talking about, look it up. Look at ABGs, and then you could understand between the pH levels, you could understand the oxygen levels, carbon dioxide levels, and so forth. And then you could use those numbers and it'll tell you more and more information about your patient. Then when you use that information, when you understand that concept, you'll know how to intervene for that patient. It's also a good idea to remember PT, PTT, and INR. And those are really important to know, especially if your patient's on something like Coumadin. You know, any of your blood thinners are really important to know these values. So if you have a patient that's, let's say, on heparin, you're going to want to check what? So if you said you're going to check for your PTT, then you would be right. So my teacher had taught us a clever way of learning that PTT goes with the heparin, because if you take the two T's in PTT, you could kind of form it into the letter H. So I've always remembered it like that ever since he taught us that, and it's been super helpful. Then the other two values, PT and INR, those ones go together as well for your other blood thinner medications that you have to watch out for. Okay, now we're going to talk all about chapter 2 within the HESI book. So now this goes into the different laws and the different torts, you may hear it called, involving nursing. So this might be overwhelming for some people, it definitely is for me, because it talks about all the different legalities involved and what you have to be aware of, but it is super, super important, especially when it comes to the HESI, because they want to make sure that you know how to keep your patient safe. So one of the biggest things that you need to know as a nurse is what role you have as a nurse. So you need to know what duties you're allowed to do and not do, and what things you can delegate to not only a LPN but a UAP. So those are different things that you have to know, and I mentioned that in my other fundamentals HESI video, that you really need to drill those in your head. So you want to understand that obviously a UAP can't help you administer medications. So you don't want to ask a UAP things that are more complex that an RN would do or an LPN would do. So make sure you go over those three things: RN, LPN, UAP. Write them all out so that you're aware of what things a nurse can do and what things a UAP can do and an LPN. That will help you a lot on answering a lot of those questions that can kind of trip you up. They really want to make sure that you know that, because it's a safety reason. Okay, so now let's get into the torts. So there's unintentional torts and intentional torts, and it's literally what it means by its name. So unintentional tort means that you do something wrong, but it was literally unintentional. And intentional, again, like it says, it means that you do something wrong, but you intended to do that, or you did that with knowledge of knowing what you were doing was wrong. So the two things that HESI wants you to know under unintentional torts is negligence and malpractice. So when you have the term negligence, that means that you're doing something wrong that breaks the law or the duty of the nurse's profession or what they're supposed to be doing, and it is obviously wrong. With negligence, it means that you do something wrong and it breaches the contract of what you're supposed to be doing as a nurse. So when you say the word malpractice, this automatically means professionals. So since we are professionals as nurses or as student nurses, then it falls into malpractice. So you'll hear the terminology medical malpractice, insurance and things like that, because that all falls under within that category. So therefore, malpractice and negligence go together. Malpractice is actually a type of negligence, which in this case is for nurses. So when you think of a nurse doing something unintentional that breaches their contract, they're actually performing malpractice, because what they were supposed to do as a nurse breached their contract or breached their role on what they were supposed to be doing. So now we have the other terminology, which is intentional torts, and this is things like assault and battery. So those are your two main ones that fall under intentional torts. So when you think of assault, it literally says mental or physical threat. So this could be forcing, and it could be without touching a client to take a medication or a treatment. So if you're literally forcing a client to do something against their will, unless there's some sort of court mandated thing going on, or if they're severely sick and you're trying to save their life, then this is considered assault. Now with battery, this is actual or intentional harm to someone else. So this could be touching of someone else as well. So it doesn't always have to be touching, essentially, as you know, like you're touching someone where they don't want to be touched or something like that, but it could include hitting or being violent with a patient as a nurse. So those two different types of torts, like I said, unintentional and intentional, are your two main types of torts that I would definitely focus on. Look up examples and different types of questions so that it could help you get into that mindset of thinking about what exactly that entails. Now there is questions online, like I've mentioned with my other video, where you could actually look up the fundamental section on the HESI Evolve website, where they actually have a HESI fundamental section. In your book, like I said earlier, it does not have that, but online when you look up questions, it has that. So it's really, really convenient, because all the stuff that I've been talking about is going to be within those questions themselves. Another huge thing that falls under crime in this section is the concept of child abuse. So if you are a nurse on the floor and you are suspecting a child for child abuse, do you go and confront the parents, or do you report it? So now if you said you would report it, then you would be right. And some people are really alarmed by that, because you'd be like, well, what if you don't know? That is the job of someone else to step in and to figure that out. It is your job as a nurse to make sure that you report to whomever that there's something going on and you suspect that the child is being abused. Because if you have a child that's being abused, they're not going to come out in front and just tell you, yeah, my mom's hitting me, or my dad's hitting me, or you'll just see bruising or whatever you may see. You could be saving a child's life. So that is extremely important. So make sure if you see a question that says, what would you do in that situation, you report it. So this may be common sense for most people, but I'm just going to say it. Before you give a patient any medications or anything like that, any sort of treatments or whatever, you need to confirm two identifiers. Their name and their date of birth are the best ones to identify for the patient, because those are two personal identifiers and it's on their wristband, so you could double check it. Those need to be done all the time. So make sure that if you have a question, I know it's super simple, choose that answer. The next thing that I want to mention is about when patients are going for surgery. So the major thing that they need are consents. You need to make sure that you have their consents signed. So now a lot of people get tripped up as far as, should the nurse be going over the procedure or the physician? You always want the physician or the surgeon who is actually going to perform the actual procedure to be going over that information with the patient. Now let's say you bring the patient back and 2 minutes later they're like, I have no idea what this surgery is about and I'm confused. Now you'll have a question right there that might say, do you roll them back and continue them to surgery, or do you call the physician and have the physician come or surgeon come and discuss the surgery again with them? In that case, you would definitely speak to the physician or the doctor and have them come down and have them further discuss the procedure with the patient, and they have the right to cancel at any point in time. Even if they sign that consent, they have the right to say that they don't want the procedure anymore. So be aware of those things and those specific little tiny details that can kind of throw you off from being like, I don't know what to do, oh, just bring them back, they might be anxious. No, you need to wait and speak with the physician before you do anything else. So this includes giving a patient medications, this includes anything that might involve that surgery or procedure. You do not want to state them or anything like that, because they need to speak with the physician before they become unconscious or they can't remember anything, because that is a huge liability if you do not have all their questions answered prior to them going under for anesthesia or whatever they might be undergoing. Another thing that I remembered talking about, and I'm pretty sure it was on my HESI, but it's about the Good Samaritan Act. So knowing this terminology is really, really simple, but it's good to know. Good Samaritan Act is where us as nurses or professionals, physicians out there in the world, when you go out and you see a patient that's unconscious and you have to perform CPR, you will not get in trouble for doing that. So if the patient dies or whatever, you will not be in trouble for doing that, because you were doing a good deed as a Samaritan, or a Good Samaritan Act, to make sure that the patient was going to get the help and the care that they needed in that very moment. So it's super important to know that concept. Another big thing regarding legalities is if you're going to implement restraints on a client. So restraints, first off, they can be in an order. They need to be ordered. It needs to be a prescription. This is something that is very, very big. This is a last resort thing that you have to do for patients under certain circumstances that the physician finds necessary. So you have to assess your patient frequently. Every 2 hours, you want to assess their skin. You want to assess the areas where they have the strains. Let's say it's on the wrist. You want to look for their pulses, make sure that they're not even more confused. You want to make sure that they have water so that they could drink something, because obviously they're restrained. So things like that you need to keep in mind. Also, another thing is, if you see an order that says restraints PRN, that's a big red flag. You never have restraints that are considered PRN. Restraints can be a huge legality issue. You want to make sure that you have, like I said, a prescribed order that needs to be redone every 24-hour period by the physician, and the physician needs to go and physically see the patient to see if they really actually do need the restraints again. So again, you want to make sure that you have an order from a physician. They need to assess the patient within 24 hours to check on the patient to see if they need another order, and they would have to formulate another prescribed order in order to have that patient on restraints continuously. Okay guys, so this covers the different laws, and like I said, the torts, intentional, unintentional, all those things that I went over. This concludes that section within your HESI book. I will definitely make another video that goes into the other half of chapter 2, which is under leadership management. But I didn't want to make this video too long, so I hope this helped. If you guys have any questions at all, leave it down in the comments below. If there's a particular topic within the 56 pages that you see that you really need help with, if it's something about lab values or something you're just not understanding, please let me know. I hope you guys liked this video, and if you did, like it and subscribe down below. I can't wait to see you guys next time. Bye!